Welcome back to the show. I am in such a privileged position as the host of this podcast to be able to speak to global thought leaders and the greatest minds there is in the world of workplace health promotion. And that is certainly the case with today's episode. My guest today is someone who, from afar, has inspired a lot of the work that I do. So some of his white papers heavily influenced my thinking when I was crafting the 8-step framework program that many of you will be familiar with. And he also inspired a lot of the thinking and content when we were designing the postgrad in workplace wellness at Trinity College. My guest is Ron Goetzel. Ron is a senior scientist and director of the Institute for Health and Productivity Studies, IHPS, at the Johns Hopkins Bloomberg School of Public Health. The mission of the IHPS, and I think their mission summarizes the work Ron is doing perfectly. The mission is to bridge the gap between academia, the business community, and the healthcare policy world. So bringing academic resources into policy debates and day-to-day business decisions, and bringing worker health and productivity management concerns to academia. So Ron's CV is incredible, as you can imagine, and we'll link to it in the show notes. I think we do a good job too in our conversation, stepping through the work Ron has done and continues to do. So that will give you a great insight into his impressive body of work. So sit back and be inspired by my conversation with Ron Goetzel. Ron, hello and welcome to the Work Well podcast.
Brian, thanks so much for inviting me. Delighted to be here.
It's a real pleasure. Tell me, how is life for you? How is work for you at the moment?
Things are, in state of chaotic wellness, I guess, would be one way of describing it. We are certainly, hopefully coming out of the COVID crisis, and people are beginning to feel better about that. But on the other hand, there are all these other things that are happening all over the place. And so you've got to cope emotionally, intellectually with all the events around you. But, I think the key is resilience and taking it all in good humor.
Absolutely. Yeah, very well said. You've had a really impressive career by anyone's standards. Would you be able to bring us up to speed briefly on how you got into this area in the first place and perhaps a few career highlights?
Sure, I'll try to make it brief. But in the 1970s, I was in graduate school and really was interested in doing community psychology and becoming what was known then as a change agent or community organizer. And I began working around New York City with daycare centers and police departments and landlords, trying to do this on kind of a larger scale. Got training in measurement and evaluation, especially survey research, design, implementation, and so forth, when I worked at a medical school at the Albert Einstein College of Medicine. And then got my PhD and moved to Connecticut, got married, got a new house, did everything within a 2-week period. So very crazy, but very, very happy, satisfying part of my life. Went to work kind of a more traditional social service agency up in Connecticut, and decided I really hated it. Fortunately, a coworker of mine who is an anthropologist, sociologist said, there's a little startup company in New Haven, Connecticut that's using Yale University's diagnosis-related groups on insurance data. Would you be interested? They're very, very small, 10 people, and they need analysts. And I said, sure, get me out of here. Joined them. It was a small startup. And I was an analyst and a researcher at first, but then kind of became the director of marketing overnight without knowing anything at all about marketing or anything like that. But it turned out that that was really a way to get into the business world and the corporate world. And even though I was terrible at my job, the service and the product that we sold was terrific. And we grew and grew and grew. Eventually, it became so big, it was bought out by other companies. But then Johnson & Johnson recruited me because they were starting a new business to take health promotion, disease prevention, from an internal program called Live for Life and offer it to other companies around the United States. And they had great programs, and companies started buying these programs. And my job was to measure and evaluate the effectiveness of these programs. So I had a team. We were actually out in California doing this, did a lot of good research, had a lot of good publications. And then I was recruited by another company that was primarily data oriented called MedStat. It in turn was purchased by Thomson Reuters. It in turn became Truven Health Analytics. It in turn became IBM Watson Health. And 26 years later, through my corporate ventures, I ended up in the business world doing a lot of research, measurement, and evaluation. But along the way, I also decided I like being an academic researcher. So we set up an Institute for Health and Productivity Studies at Cornell University, moved it to Emory University, and now I'm at Johns Hopkins. And that's what I do for a living, is the director of the Institute for Health and Productivity Studies.
Fantastic. Yeah, well, what a journey. And are you still involved with IBM Watson Health as well as your the university work?
No, I left that job last year. I still work with the IBM researchers on projects together, but I'm now fully an academic.
Fantastic. Yeah. And it's so clear the trend there throughout your career for data, for measurement, for analytics. Has that changed, would you say, in the past, in recent years from a workplace well-being, health promotion perspective, what people are measuring and what organizations are tracking?
It has. When you go back even into the 1970s, most of these programs were executive wellness programs, essentially having your executives come in and have their blood pressure checked and their blood and their heart and all that, make sure their executives were healthy. And that was pretty much a concierge type of program. And then it expanded in the late 70s, and where executives started saying, this is good for me. Why can't it be good for everybody else? Why not offer this to all of my workers? And back in the 1980s, it was primarily the kinds of programs that were awareness building and having people go to training programs and classrooms and seeing videos and so forth about how to be healthy, getting their blood tested, checking for disease and so forth. But it was still mostly individualistic oriented. And then the business community said, well, wait a minute, there may be a spillover into productivity, not just healthcare. And I think that's where Ireland and other countries that have universal social healthcare systems became even more interested, because if you could show a relationship between people's health and their risk factors for poor health and productivity, like absenteeism and having safety incidents and disability and on-the-job productivity loss, well, maybe we should be paying attention to that, because it's no longer the government's problem. It's really our problem as a business. And so there was a movement towards health and productivity management. And then more recently, I've become very engaged in the community and how public health plays an important role. So when people work, they go to work in the morning, they leave work in the afternoon, but then they go back to their communities. And what if their communities are unsafe, or they don't have good food choices, or they're crime-ridden, or they don't have parkland, or there's high crime and schools are terrible, and so forth and so on. Well, you really go back into the cesspool. You may be protected a little bit at your job, but you go back in the community and all the bad things that influence bad health are still there. So I've started over the last 5 or so years looking for partnerships and collaborations between business and health, and kind of making the business case to both business and public health leaders that the other entity really does matter. That you should be a partner with them because they have an enormous influence on the community's health and well-being.
Excellent. Yeah, it's a new enough area. I mean, I suppose we've heard of CSR for a while, and ESG is a more popular term perhaps now. But it's certainly the World Health Organization use it in their kind of the 4 quadrants of health promotion, isn't the community or the enterprise involvement in the community. So that's something you're kind of trying to bridge the gap in, is it?
It is, and usually they travel on parallel tracks. They don't see each other. They don't talk to each other. They don't go to each other's meetings. And quite honestly, public health is suspicious of the business world, because they're just capitalists, money grubbing, people want to make a profit. And the business people are suspicious of public health because they say, well, they're trying to control our lives with rules and regulations and, all kinds of sanctions. The idea now is to get them to understand where each is coming from and what the rationale is for what they're doing. And they are actually quite tied together in terms of survival. And there are many, many, many ways where they can see shared value. And so we've tried to put together those kinds of things. First, as a publication, we talked about the business case for working together. The second, right as COVID was beginning, what can businesses do to address the COVID crisis and prevent future outbreaks and deal with that kind of preparedness in the future? So we put together 2 reports directed at the business office with public health input into that as to why they should be working together. Excellent.
Yeah. You mentioned the business case there a couple of times. That's something that comes up quite often, certainly in my conversations with organizations, but let's say maybe well-intentioned well-being or HR leaders trying to get the attention of the senior leadership team to get them to really buy in to what they're doing. Any advice on how they could go about? I mean, is there a definite path for securing that buy-in, or does it depend really on the organization, on the particular business case?
It obviously does depend on the organization and the business leader. Some business leaders get it. You don't have to explain it to them. Yeah. They say, yeah, you're right. Let's do it. Let's do what's needed. Others, of course, need more motivation, more impetus to do that. One of the best ways to get a message across, and now I'm speaking as a data person, is to tell a story, and to make it very, very personal. I mean, do you know anyone who has diabetes, who has heart disease, who has asthma, has cancer, any of those conditions? How has that affected you in your life? What were the factors that may have contributed to that? Individual factors, but also environmental factors, organizational factors. And let's talk about something really personal right now: stress, depression, anxiety, state of mental non-wellness. Is that something that you're seeing? Is that something you're experiencing, your senior executives? So what can we do about that? First of all, do you know you've got a problem? Second of all, what might you do to help correct that problem? Thirdly, let's think about ways of putting that in place. And then most importantly, let's measure and evaluate that these ideas are actually having an impact, having an effect. And you then bring in some data, say, well, this is another company that tried this, and here's what they found. Here's another organization. Here's another community. What about we try things out in your organization and then measure and have milestones and have gates so that if these things don't work, just get rid of them and try something else.
Excellent. That's a lovely way of, I think, articulating what Adam Grant says as well. And he summarized it very briefly when he says it's hard data plus human stories is how to bring it in. So certainly the storytelling, I really feel that. And I can't imagine there's any leader out there who wouldn't have, or some story that would resonate with them. On the data side then, are you seeing, is it all ROI? Is it all purely return on investment? Or are we seeing more of a case now for the value on investment as well that you touched on?
Well, when we first started doing a lot of research, it was primarily ROI focused, return on investment. So for those listeners who don't know what that is, I'll give you $1. You give me back $1.50 or $2 or $3 in return for your investment, which works beautifully if you're putting in new machinery or new technologies or new mechanisms to improve efficiency. But how does that work in terms of people's health? So somebody is unhealthy, I'm going to give you $1, and that's going to make that person healthier and also give me back money. I've never seen that happen in real life. Somebody's sick, they go to the doctor, they go to the hospital, they get medicine, so forth. All of that costs money. You never actually get a rebate check in the mail and say, well, this person's well now, here's the rebate. They've spent the money, it's a service. And the real question ought to be, the cost effectiveness of that money. So are you spending it well? Are you getting good value on investment for that money spent? And that's why we've shifted over from a return on investment to a value on investment. So what is it that you want to purchase with that money? Now, my rationale, my reasoning is that if you can document that your investment actually improved the health and well-being of your workers, that's a good VOI, and it didn't cost you that much. It is probably a good VOI. If you want ROI, there are a lot faster, cheaper ways to get a return on investment. Most notably, just take away benefits from people. You won't have to pay for them.
Fantastic. Yeah. When I'm talking to people and to companies, and they ask the question, how do we measure? How do we know if this is working? Well, this is what I suggest. I'll be interested to get your own thoughts on it. I say, who are the key stakeholders that are going to be interested in this, in your results in 1 year's time? And picture yourself in a room with these key stakeholders in 1 year's time, and you're presenting back to them, looking back on the year. What statistics, what data do they want to see on that screen, on that board? Is that a good way of approaching it?
Absolutely, absolutely. I would go a step further, Brian. I would say, let's get those stakeholders in the room right now before we even start anything. And let's go around the table and ask them that question. What do you want this program to do? And wait patiently for them to think through and articulate what it is they want. Well, I want people to be more engaged in their work. I want people to lose weight. I want people to exercise more. I want them to quit smoking. I want them to show up to work. I want them to have lower healthcare costs. I want them to be more productive. I want them, create a culture of health. I want, and the list goes on and on and on. And then you say, well, that's terrific. How much do you think we ought to spend on getting all of these outcomes? And they'll say, well, $1, €1, £1, whatever it is. That they want to spend, and then they also say, well, I want an ROI on that. Not only do I want to spend the money, I want to get money back as a return. So once you kind of lay it on the table and say, let's get your goals, ambitions, aims out there. Let's think about how to get there. And then you get into the question of measurement. So how do we know people are happier in their jobs? How do we know that they're less stressed out? How do we know that they're actually feeling more energy? How would you gather that information? I mean, that's really the hard part. Getting the data, and there, obviously, that's what I do for a living. There are multiple ways of gathering data, organizing data, but what's important is that data by themselves don't tell a picture. You've got to interpret the data, then you actually have to turn it into knowledge and wisdom, and tell the story of what the data tells you, because just giving people 500 charts and graphs is not going to, they're going to go wild trying to figure out what all this means.
Very true. For an organization getting started, would you recommend, starting small? I mean, there was a lot of examples there of different measures and metrics. Would you maybe focus in on one or two really important kind of the priority measures for an organization that's getting started?
Right. So once you have this meeting of the minds of all these stakeholders sitting around the table saying, well, let's try to focus in, hone in on those things that are most important to your organization. Let's prioritize 1, 2, or 3 things that we want to really measure, because those are critically important for everybody in the room. And now let's figure out how to measure those things. And to make it even better, why don't we try it out on a pilot basis? Instead of the entire enterprise getting this all at once, let's start with this division, this location, this group of people right here, and see how it works. Beta test it, try it out, and see if there's a response, a reaction. Maybe we have to turn up the heat. Maybe people don't like it. Maybe, the way that you're communicating it doesn't make sense. And then, if it works, scale it. If it doesn't work, let's go back to the drawing board. Excellent
advice. I love that idea of a pilot. I think that's a really great starting point for some companies. Ron, it was your 2014 paper, Do Workplace Health Promotion Programs Work? And then you had a 2016 paper as well with Karen Kent, Promoting Healthy Workplaces. It was in those two papers, really, I first understood, I guess, the importance of building a culture of health. as opposed to, I guess, what I still see quite often is random acts of wellness in a lot of organizations. Could you talk about that, a culture of health, and what that is, what that might look like? And maybe, I don't know if you have any examples of companies that you work with.
Sure. So that 2014 paper published in the Journal of Occupational Environmental Medicine was entitled, as you said, Do Workplace Wellness Health Promotion Programs Work? Interestingly enough, that same month, same year, the New York Times had an article with the same title, Do Workplace Wellness Programs Work? And their answer was usually not. Now, our answer was, it depends. It depends upon whether the programs are well designed, well implemented, and well evaluated. And certainly a large number of programs don't work, and that's because they go back to the old model that I talked about earlier. Having people who are willing and interested and engaged sit in the classroom, learn how to eat better, how to exercise, how to manage their blood pressure, and so forth. But most people, don't really have the time or interest in doing that. So that's the old traditional way of running health promotion programs. Culture of health means that when you walk into an organization, you feel it. There is a medical director named Peter Wald, who retired recently from USAA, which is a large insurance company in San Antonio, Texas. And he said, what I want to happen is when people walk into my building, which had like 20,000 people in it, there is surround sound. They are constantly getting messages, communications, bombarded with health and healthy workplaces. So everything we do, from cafeterias to gyms to nap rooms to walkways to outdoor facilities, everything says, we want you to be healthy because we want you to do your job well. And they're getting that message all the time. So that's kind of a good example of a culture of health. And there are many, many other companies that have that. We featured them. There were 9 companies we featured as part of a Robert Wood Johnson Foundation project we ran a couple of years ago. And the Karen Kent article that you referenced is a summary of what we found. What we did was look at the literature, but we also went in and visited these companies. We spent time with them, spent time with their workers, with their leaders, with their program people, and said, what is it that you do that's so unique? Tell us. And out of that project, we came up with essentially the 10 secret sauce elements or ingredients for a healthy company culture. And certainly it starts with leadership commitment and leading by example, and ending with measurement and evaluation to make sure that what you're doing actually works.
Excellent. Yeah, and there's I love that paper, and there's an accompanying video that goes with that, which I have actually shown to students on the postgrad in workplace wellness here that we run at Trinity College in Dublin. So it's a whole package, isn't it? There's the paper, there's the case studies, and there's the accompanying videos then as well that go with it.
Indeed, yeah. This was an interesting topic because Robert Wood Johnson Foundation said, well, you've done a lot of research and that's all well and good, but people who read research articles are academics, doctors. What about getting it out to the corporate community? So they said, why don't you take along a journalist on your visits and have that journalist write things as well. So we did that, and the journalists would write stories and put up podcasts and blogs and so forth. And they're very human stories that relayed kind of what the essence of these companies were doing to improve a culture. Excellent.
Yeah. It's I guess the Karen Kent paper then as well. It touches on you're kind of hinting at it there, communicating strategically. That's something that I took on board. I've got an 8-step framework for developing a workplace wellness program that lasts. A lot of that will be influenced by WellCoA, again, who I'm a big fan of, their 7 benchmarks. And then the paper with Karen Kent and yourself about the importance of that communicating strategically. I've seen so many organizations that actually have a robust program, interventions, policies there, but a lot of the employees don't even really know a whole lot about the program, about the interventions or what's available. So it's so important, isn't it, to get that message out there and be consistent with it?
Absolutely, yeah. Consistent, credible, loud, but what you're touching upon is also the need for a strategic plan. Every business has strategic plans and has annual reports, why not our business? When we go into an organization and we say, here's how we're going to do this. Here's our mission, here are our values, here are our tasks, here's our structure, our staff, our goals, our interventions, our programs, and here are the measures. So you basically set that up at the beginning and renew it each year and produce an annual report. That's what business people want to see. They don't want to just, as you say, random acts of wellness. They want a strategic map of how to get things done, and they want metrics for accountability purposes.
Business people want metrics. They also want awards, don't they? Right. And that's something you're involved in at least two separate awards. Certainly the C. Everett Koop Award, and I think a newer one is the Caroline C. Mattingly Award for mental health in the workplace. Could you tell us a little bit about those awards?
Yeah, absolutely. So as you point out, organizations and leaders of those organizations love to be recognized. And, honestly, it's a recruiting and retention tool. People want to work for socially responsible organizations. That's proving to be more and more the case with CSR and ESG and all that stuff. So the C. Everett Koop Award, people, even in this country and certainly in Ireland, probably don't know who Dr. C. Everett Koop was. He was the U.S. Surgeon General during the Ronald Reagan administration in the 1980s, conservative Republican who did an enormous amount of good public health work in the area of AIDS prevention, smoking, contraception, women's health, and so forth. He was really a maverick, and he did it so well. One of his areas of interest was improving the business of America and making businesses accountable, responsible for the health and well-being of their workers. And he said, we're going to have an award program named after me. But what you have to do to win the award is have documentary evidence, data, to show that you've improved health, but also produce positive business results.
Right.
So you got to have both. You improve health, but also show a return on investment, value on investment, have positive business results. We started the program back in 1994. It's been going on now for 50 some odd years, thereabouts. Not quite, no, 25 some odd years. Yeah, I'm way ahead of myself. But we have about 75 plus winners of that award. And some years we actually don't declare any winners because no one has produced enough good evidence that their programs work. Some years we have more than one winner. So it's not just a winner, it can be multiple winners. And we have honorable mention people and companies that are not quite there, but they're close, and all they need to do is do a bit more work, and we provide them enormous feedback. There are 15 judges that review each application. Each one writes up their reviews and tells people what they did right, what they need to improve on, and they can come back the following year and resubmit their application. So that's been going on for many years, and many large and small companies have won the award. And the Carolyn C. Mattingly Award, which we just started this year, is one that is focused specifically on mental health and wellness and well-being in the workplace. And the origins of the award was a very tragic event where a senior vice president of a foundation in America called Cystic Fibrosis Foundation, very large multi-billion-dollar foundation. One day, he and his staff were firing an employee because of misconduct. Basically, the employee was stealing from the company. And the employee left the organization, went to Rich Mattingly's house in Bethesda, Maryland, killed his wife, Rich's wife, set the garage on fire, then drove off and killed himself. And Rich Mattingly and his family said, I could just sit here and mope and feel bad and feel sorry and be totally, unproductive for the rest of my life, but I won't do that. I'm going to set up a foundation to try to prevent these tragic events from happening again. And he set up something called the Love You Project, which was the signature that his wife Carolyn put on all the notes that she sent out, and funded work at Johns Hopkins, and also funded the Carolyn C. Mattingly Award for Mental Health in the Workplace. We got together a lot of experts in the academic and business world to put the criteria together, We published the origins of those criteria, and that award just opened up in January of this year. And we'll be reviewing applications through May, as is the case with the Coop Award. So that's the Carolyn C. Mattingly Mental Health Award, part of the Love You Project, and the Coop Award is actually part of the Health Project. And Love You, by the way, is spelled L-U-V-U.
I saw that. Yeah. I didn't know the origins. Thank you for sharing. It's what a tragedy, but great to see such a positive outcome and legacy, hopefully, as a result of that. I like the idea with the C. Everett Koop Award that some years there isn't a winner, some years there isn't an award. We have accreditations here in Ireland, and I welcome them. I think they're a really positive development because you do need documentation, you do need to show data, but they're quite expensive for companies to apply for. So it's really only for the larger organizations. And, I'm yet to see or hear of an organization that hasn't, once they work through the process, that hasn't received the award, I guess. So I think it's welcome to hear that not every year it happens. You just simply don't meet the criteria. And that's the way it should be. It's a high level, it's a high standard to meet. So you got to meet that standard.
Exactly. And by the way, both awards are free of charge. There is no application fee. Any organization can apply, and they get a huge amount of feedback on their application. But the bar is set very high. So to earn either the Coop or the Mattingly Award, you actually need to do a bit of work. And especially with the Coop Award, you actually have to have tables and charts and statistics and all that to pass muster with our reviewers.
Excellent. And the Coop Award, so that comes out of, is it the HERO organization, the Health Enhancement Research Organization?
Well, we have been partners with HERO for many, many years. I was one of the original board members of HERO. And HERO provides the venue where we hand out the award every year. It usually comes at the HERO Forum in the fall. But they are two separate organizations. HERO is a separate nonprofit, and the Health Project is a separate nonprofit. But we have worked together for many, many, many years.
Right. You're involved with quite a few nonprofits and organizations and awards. So what's the Health Project then? Is it just the C. Everett Koop Award that the Health Project manages? We've limited through the years for that, simply because we're basically a volunteer organization. No one gets paid. We're shoestring budget, if a very rich benefactor from Ireland or anybody else wanted to give us $1 million to expand its focus and do more things, we could do that, including help. We're now beginning to help some organizations figure out how to apply for the award, but doing it in a public manner so that if somebody has a question, we'll answer the question. We provided a lot more guidance about how to do measurement and evaluation. We'll be doing more webinars and seminars on that, but we have primarily limited to the award itself for all kinds of reasons, including we don't want to get involved in conflict of interest issues. Sure, of course, yeah. I was actually speaking to Sir Carrie Cooper earlier and talking about the UK, their national forum for health and well-being. And again, it's kind of volunteer, kind of bringing people together, companies and people together to share and learn from each other. Again, not for profit, but looking to promote, I guess, and raise all ships, if you like, and share lessons learned. Don't think there's quite an award associated with it, but there's outputs, there's, useful information to help guidance for companies, if you like.
Yeah, I think we who are in this business think that every company is doing that. In fact, in the United States, if there's surveys out there that if you ask organizations, businesses, do you have a wellness program, roughly 80+% of the businesses say, yes, we do.
Yeah.
And what it may be, which is all very good, like flu shots being offered at the workplace or things like that. But in terms of comprehensive evidence-based programs that are likely to have enough of a therapeutic dose, enough to make a difference, it's probably around 15% of businesses that actually have programs that are going to make a real difference. And so our job, all of these organizations, is to as you say, raise the tide so that all boats are lifted. Everybody can learn through awareness building organizations, through award organizations and so forth, how to do it right. Because if you do it right, there are so many benefits, including, we've done studies on this, having a better stock price than the average for those organizations that actually have exemplary programs.
It's a really great point you raised there, because I find it the very same thing here. I don't think that I've ever had a conversation with a company or with an organization who's told me that they don't have, a well-being program. But when the conversation continues, they might have like, employee assistance program, which is excellent. They might have mental health first aiders, again, another fantastic awareness program. But then they feel that they're done, they've done everything they can do and they can kind of kick back and get back to work kind of thing. How do you have a conversation then? How do you encourage those companies who think they have a well-being program to maybe step things up, to move it to the next level, to, let's say, organizational interventions that could actually really prevent illnesses as opposed to manage and treat?
Right. So, I go back to my research and data analytic background and origins. Long ago, what I was taught was there are 3 different buckets of measures. And the first one is a structural budget, which is basically check off the box. Do I have an EAP? Do I have a wellness class? Do I have a gym? Do I have this? Do I have that? So those are things that are in place. And if you do it right, then you have all the structures in place that you need to have a good program. By the way, there are many things on that list. And there are a number of scorecards out there that allow you to do this checklist approach, like the CDC scorecard, the HERO scorecard, American Heart Association scorecard, and a few others. But the second part gets a little bit more complicated, the process bucket. And that means, are people actually using these programs and services? Do they like them? Do they think that they're being benefited by it? So that's the process engagement part. And then the final one is the outcomes bucket. Okay, that you've got the program, people like the program, they're using the program. Are you actually improving health? Are you saving money? Are you improving productivity? And are you achieving some things that are of value to you, like being recognized as a responsible company, having higher stock price, attracting, retaining talent? You need to measure dimensions in all 3 buckets in order for the program to be helpful. You can't just have a checklist approach. We got it, we're done.
I like that. I haven't heard that approach before, the structure, the process, and the outcome. That's a nice one. Yeah, thank you for sharing that. Yeah, I mean, it's the challenge, isn't it? Just trying to have that conversation, trying to move these very well-intentioned organizations who believe they have a robust program in place, just trying to encourage them, trying to nudge them to do that little bit more, to take that next step. A question for you in research terms, and like I could pull out a lot of numbers here, but here's one, and this goes back to March of 2020, and a Google Scholar search mentioned that, so Ron Goetzel was cited 44,653 times by fellow researchers. That number has probably increased, I'm sure has increased since. I'm just wondering, giving that, incredible back catalog, if you like, of research, are you interested in do you see any gaps at the moment in workplace health promotion, or are you interested in doing any kind of research? Is something jumping out at you at the moment that really excites you?
I think all the things we've talked about so far are still researchable topics. We don't stop doing research in medicine just because, we know that aspirin can help you with a headache or something. There are so many different areas to study. And I think the places that still require a lot more research is the area of best practices. So we do have lists of best practices. We have them from site visits, from conversations, from people in the field who've been doing it for a very, very long time. Those are the basis of scorecards, and sometimes there are scorecards that talk about combinations of interventions. So as I mentioned, the CDC scorecard has 154 different interventions that you can put together. The question that's most often asked is, okay, if I can only do 5 of these things, what should I be doing? So there really isn't a whole lot of research about the combination of different elements of a scorecard. We do know that the more you do, typically the better off the outcomes are. And there's usually this tipping point somewhere around 2/3 of best practices where you really see a jump in outcomes. So it doesn't mean you have to do all 100% of them, but somewhere around 2/3 of them is where you really see a difference. And there's some that are much more important, like leadership commitment, culture, strategic plan, measurement, and so forth. But we need to put together these toolkits that employers can use and say, well, I've got a limited budget. Where should I be focusing that money? And we've done some work in this area. We published a paper with the Trans-America Center for Health Studies last year that looked at specific interventions targeting hypertension and diabetes. And we not only looked at the effectiveness or impact of those interventions, but also the cost and the cost effectiveness of those interventions. And we rated them. So I think we need kind of a consumer reports for the business community that says, okay, how do I pick from this category and that category and a third category to give me the best outcomes? And then how do I actually prove to myself and my board of directors and chief financial officer that this stuff actually makes a difference?
Yeah, again, another great point. I think that's, we have the research. In most organizations, the intention is there to do something meaningful. It's just kind of trying to bridge that gap, isn't it? From the implementation to actually support the organization with the implementation and to do it properly.
Right. And I know that the research community is always looking for randomized clinical trials where individuals or work sites are randomly assigned to treatment and control. And I think that's great. As a researcher, I'd love to do RCTs. The problem is that when you go into a workplace, let's say you go into your workplace or the company right next door to you, and you say, I'm going to make you a healthy workplace and I'm going to leave these people alone. And I'm going to say, well, Brian, you now have to be a really dynamic, resourceful, energetic, charismatic leader. You've got to devote a lot of money to this program. You've got to build gyms. You've got to have classes. You got to, do all these fun things with your workers. This other company next door, we're not going to do that. And you do this with hundreds of employers in order to do a randomized trial. I don't think it's realistic to expect business communities to do that and to sustain that for 4 or 5 years. So the holy grail for research of randomized trials, I don't think applies for workplace programs where there's so many things that you would need to manipulate. So hard to get that over the line. A question on interventions then, and I'm sure you see this all the time. When you run something, when you run a program, an intervention, quite often it's the people that are already well that sign up, that attend, that are in the front row of the workshop or wherever it might be. Any suggestions? Have you come across any research that can help organization encourage those that perhaps need the interventions most to get involved? Yeah, I mean, part of it is making it an environmental intervention or a policy intervention instead of just an individual intervention. So let's say you work for an organization like USAA that I mentioned earlier, and they've got resting pods or meditation areas. They've got workout stations right outside where your work location is. They've got people you can go talk to if you need some counseling right there. You've got a medical clinic where you can get all your vitals checked. You've got an outdoor field where you can play Frisbee. You've got walking track downstairs that you can, blow off some steam. All of a sudden, you don't need people to sign up for a class. People can, on a very impromptu basis, say, all right, I'm going to go for a walk, or I'm going to go relax, or I'm going to go meditate, or I'm going to go, whatever. And it's really the environment that is promoting health. The cafeteria has the salad bar up front. It's easy in and out. If you want to order a cheeseburger, you'll have to wait 20 minutes to get that. So basically changing the environment so that it is conducive, and it's the easy option as opposed to the complicated one.
I love that. So nudge theory, making it the easy choice all the time, where it's almost by default, people are choosing the healthy option. Yeah. Mm-hmm. Then the healthy work environment is what supports that. Ron, final question. You've been so generous with your time. Crystal ball, what does the future of work look like? What does the future of workplace health promotion look like? I guess we're probably looking at a hybrid model now from here on in. Any thoughts on that?
Yeah, I think it is going to become much more complicated, will require a lot more creativity, because we're used to the model where people congregate at a workplace and they have access to a whole lot of programs physically in that place. And for many people, I think that may not be available. Offices may be closing down. We don't really know what's going to happen, as a post-pandemic period, which hopefully is upon us or will be upon us very soon. So I think we're going to have to be very creative of how we get people on the same page. And I think one of the best ways to do it is with young people and to make it a very social activity. Mm-hmm. I think everybody yearns for contact with humanity. We're sick and tired of talking to TV screens and doing things virtually. We want to be together with our friends, with people we like, and hang out and do things that we enjoy doing, whether it's a walk in the park, playing a game, doing things that are mentally healthy as well as physically healthy. And then, putting together affinity groups, people who are young parents, people who love reading books, people who like to knit, people who like to talk politics and so forth, getting them together to do that, but also at the same time do things that are healthy for them, to connect those two lands, to those worlds. How to do that, I think it's really up to the next generation to figure out that kind of innovation. Mm-hmm. I don't believe it can be done through a smartphone alone, because I think in many ways that creates greater distance between people. I think we need to be physically present with one another to enjoy one another and be mentally and physically healthier.
Sounds great. Yeah. And I guess what this does open up is it opens up the whole new potential world of research for workplace health promotion in a hybrid world as well. So there's certainly no shortage of topics for research, I guess.
Never.
Well, Ron, listen, your research has been a huge influence on me, my work on the Workplace Wellbeing Ireland and WorkWell communities. It's been a real privilege to have you on the episode today. So thank you so much for your time and for sharing so much.
Brian, it was a pleasure to engage in a wonderful conversation with you. Thank you for your time and for your interests, and all the very best to you in Ireland and throughout the Western Hemisphere and Eastern Hemisphere as well. So really appreciate the time we took together to talk.
Thanks, Ron. And hopefully we'll see you in Dublin soon.
Oh, I'd love it. I'd love it.
Take care.
You too.
And that's a wrap for this week. Go to workwellpodcast.com if you'd like to access the show notes for this episode. Quick favor to ask. Can you head over to iTunes or Google Play or wherever you get your podcasts to subscribe, rate, and leave a review for the WorkWell podcast? It will be a huge help. So thank you. If you want to dive deeper in the area of workplace health promotion, if you want to educate yourself in this area, then make sure to check out the WorkWell Institute. It's our online learning hub. It's a one-stop shop for all your workplace well-being training needs. You'll find all the details at workwellinstitute.org. By the way, the original music that you're hearing right now was composed by my good friend, Greg Clifford. Check him out at gregcliffordmusic.com. Thanks for listening right to the end. Remember to work well, stay safe, and I'll see you on the next episode.